Hi, my name is Dr. Evelyn Serrano, and I'm going to be talking today about the topic of hysterectomy. So hysterectomy is typically, by nomenclature, the removal of a woman's uterus with the lower part of the uterus, which is the cervix. This can be with or without the fallopian tubes and ovaries. Some kind of older nomenclature for hysterectomy is partial versus full hysterectomy. So a partial hysterectomy, for us as gynecologists, means the removal of the uterus with also the cervix. The full hysterectomy would also include the tubes and ovaries. Now, when we're talking about hysterectomy, there's many different reasons why women may choose to have a hysterectomy. Abnormal bleeding or heavy periods, pelvic pain due to conditions like endometriosis, adenomyosis or pelvic congestion, uterine fibroids, or ovarian cysts. The decision to make for a hysterectomy would be with the patient and the gynecologist. Now, when women and gynecologists are choosing their hysterectomy, there's really three main ways that you can have this performed. The first is a more old-fashioned approach, although very appropriate in some cases, where we do the hysterectomy through an incision that's similar to a cesarean section. The advantage to this kind of hysterectomy is it allows for us to remove larger uteruses that may be complicated by things like fibroids. With this kind of hysterectomy, typically patients can anticipate to be in the hospital anywhere from 1 to 3 days after the surgery, and usually to full normal activity, it's about 6 weeks, although patients usually are doing normal daily routines in about 1 to 2 weeks. Another approach for hysterectomy is vaginally. And so this is one of our most preferred approaches because it avoids any kind of incisions to the body. The downside to vaginal hysterectomy is that sometimes you can't always accomplish it because of the size of the uterus or because of surgical history for the patient. So that's something that patients could discuss with their gynecologist. For vaginal hysterectomies, typically patients are in the hospital, perhaps even going home same day, but usually the next day, and return to normal activity is usually about 2 to 3 weeks. The third type of hysterectomy that we perform is what we call minimally invasive hysterectomies. And so these are either performed either laparoscopically or with a Da Vinci robot. The advantage to these kinds of hysterectomies is it's much easier to remove the tubes and ovaries, and it also gives you a chance of evaluating the entire pelvis. And if the patient has an extensive surgical history or history of adhesive disease, this is a much easier way to accomplish this task. Typically, with a minimally invasive surgery, patients a lot of times can even go home the same day, if not the next day, and return to normal activities about 2 to 3 weeks.